standpoint, there's two of us that works with the guy, and we can keep him going. I see him a couple times a year. But it's a balancing act. It's a very complicated balancing act now. Fascially, for me, to keep balance on this guy. And, of course, with working with the chiropractor. Well, where else is he going to have problems? He's going to have problems in his neck. He's going to have problems in his back. So it's an interesting balancing act that we have to do with him. But the key, again, is what I keep saying, the key is balance. Not symmetry. This man will never have symmetry. But you can give him balance.
Over a long period of time, do you see in something like that, where you're rocking over a long period of time, do you see a change in the bone itself?
Sometimes I have, yeah. Or what appears to me like a change in the bone. I haven't seen an x-ray of it. You're not going to get this here. One of the things you're dealing with, on top of the fact that the bone has now been wedged and cut out, a wedge driven into it, you're also dealing with the whole assaulted surgery on top of old surgery scars. But for him, you see, this is important information if he comes in to get a massage from you. It's really important information to see the movie of this. The other thing I want to say about taking a history, it's real easy to get into the things that are wrong. They got along fine without us. They got as far as they got without us, you see. There's something that's working right. They walked into your office. You follow what I'm saying? So look at the things that are right and make them better. Don't try and correct the things that are wrong. Take the things that you can really look like a star if you take the things that are working and make them work better. There was one other question I don't think that I responded to about medication. Sometimes with some of the medication, it will affect the tissue. It'll affect, if you ever put your hands on somebody that's like been on medication for a long period of time, and you put your hands on it, it's like putting your hands on styrofoam. You do an effleurage up their leg, and you've left an imprint, like you put your finger in styrofoam and it doesn't bounce back at you. Have you seen those? Well, what do you think? Have we given you enough information today? Are you on overload? Seems like we've been doing this a week.
What are you going to do with that?
What am I going to do with
The styrofoam.
That's what you thought you were asking me, what do you think? Yeah.
Oh. It's hard to differentiate layers from a Rolfing standpoint. It's hard to differentiate layers with that. You're limited. It's like it becomes a barrier. You know, you're not going to be able to do the type of work that you would do on a normal person that would walk into your office. Again, let me talk about the car wash massage. If you find yourself doing car wash massage and getting bored and tearing your body up, you've got to add some creativity to it. You hear me? You hear what I'm saying? You understand what I mean by car wash massage? Somebody taught you to do 4 of these and 3 of those, and that you're going to do that, by God. Come hell or high water, you're going to do that.
Well, there's so many people that are addicted to things like prednisone.
Yeah.
Which screws their body up so much.
That's a styrofoam drug.
And what I've done is given them books like East Connection, things like that, and they've gone on a diet and lost lots of distension, lots of, retention, and
their tissue starts to feel bouncy again, that's right.
it's a really chain reaction.
So another thing that you're doing is you're not out there trying to practice medicine, but you can also disseminate information. Here, read this.
Yeah.
Buy this book. Did you ever think of this? We have covered a lot of ground. What I'd like to do tomorrow, I don't want to start it tonight, what I'd like to do tomorrow is I'd like to get into the self-care, ritual of self-care. Let's get into that. And I want to at least take an hour for you to pair up and just work on each other. And I don't know if we'll have time because we're kind of pressed, but we can use the other video camera if you want to be videoed and see what your body's doing moving its face while you're working. Okay? That will be available to us too. So we may run over tomorrow, if that's okay, if you don't mind. And if you have to leave, you can leave, but is that okay, Ian, if we run over a little bit? 'Cause I don't want to rush too much. And I would like to give you at least an hour to pair off and just do your thing on each other. Well, why don't we, well, why don't we close it up for tonight? Hold it, the head, and holding it at the right angle, and forcing something to change that you're not even touching. You're forcing it to change here. It's the same thing here. What you're doing is you're touching the radius, let's say, and you're rolling the radius. The change has to take place in here. The other thing is with like an inverted pendulum type of approach. If we've got this, and we create this motion, what happens? Well, yeah, you have to change, the fibers have to make an adjustment in here. So you're affecting deep, but what are you doing? You haven't got your hands deep. Your hands are surface. And you're making the change deep.
How about someone who's had their arm in a cast, and so they didn't really move it, and then in the sling, that this part hurts, the surgery's been up here. If I do the move you taught us yesterday to working deep with the radius in through here, working this point, that'll help alleviate some of what's going on here.
Absolutely. I don't know until you look at it. You may want, what may have happened is that all the problems are down here maybe, and not up here. Discomfort may have something to do with it. And remember that thing that just keeps coming up, and if you've studied metaphysics, it goes back clear through the ancient Hebrew. So as above, so below. That's always.
So if you work on some...
That's like the golden mean, it's everywhere. Anything that is stable and has order, it's always that way.
But if you work on someone who's got this problem area, so you're working here, you should always work on the other side to help balance that out.
Always work on both sides, always. See, that's one of the things that physical therapists do that just irritates the hell out of me. If you got a sore knee and you've been prescribed physical therapy, you're only going to get your knee worked on. You probably won't have to take your pants off, have your own leg, your pant leg up. Think about it. A knee goes from here to here. This is what a knee is. And so as above, so below. So they don't do anything to the ankle. They don't do anything to the way the thing relates and connects in here. And they don't do anything over here. They don't do anything to the other leg. And the other leg is okay. This is the one you hurt. This is what we're working on. Does your knee feel better? I never touched your knee. Do you understand the concept I'm talking about? You don't have to touch deep to be deep. You follow what I'm saying? So, you're actually on the surface, but you're forcing them to be deep.
Forcing
Well, you haven't got a gun to their head, it's not coercion, but, you know,
them. But they
if
have
there's
to,
going
what
to be
you're saying,
movement.
they have to?
Yeah, if there's going to be movement and there's going to be length, it can only happen in one place. And that's as deep, you can't get any deeper in an interosseous membrane, you know. And that's down in there around periosteum. How can you get any deeper than that? Just like through the thorax. You use the weight of that head, and if you're the right person and you've said the right things and that body trusts you, it'll lengthen. But it'll lengthen how deep? You're talking about all the stuff around the heart and in between the lungs. All that is lengthening. It's getting long. And you didn't have to put your, I'm saying it again, you didn't have to put your feet on the ceiling and your elbow into it.
Is that the same then too? I mean, would you be going deep essentially and accomplishing some of the same things when you do like very gentle fascial releases at
No.
different, is that,
No,
what are you
no,
accomplishing
no.
then?
The fascial releases are, that's a direct approach, okay?
That's a direct,
Very direct approach. And
and I don't mean,
I've
I
never
don't
s-
mean a lot of pressure, I mean just, a hands-on type thing
Yeah,
too.
yeah.
At
the fascial release techniques that I've seen are more energetic than they are fascial. Okay, that's my opinion. I don't see any structural change, and I don't see.
You don't think there's lasting and it's what
No, I don't know. Absolutely not. No. Fascia. Now if you take if I as a Rolfer take a body that I think is pretty advanced, I can do some pretty interesting things with it, and really look like a hot shot. Okay. But I'm calling up all the order of all the other Rolfing persons hand, for God's sake. What I did with her is I was basically calling up on all the Rolfing. There was a few things that I did that were little uncharted territories, but it's places where the fascia tends to get real thick, turn into a real thick aponeurosis that if it was a dissection, you'd have to kind of saw through it. Now you can do fascial glides and fascial releases to your blue in the neck, and you're not going to change that part of the fascial structure. You may have some effect on distant part of that same layer of fascia that connects to that heavy aponeurosis, but you're not going to change that.
What do you think massage does? Do you think
I think massage over time does change
you would
it.
get a definite
Yeah,
structural
massage over time can create a structural change, and you need to be aware of that. So that's why I'm insistent on you seeing core and sleeve in 90-degree angles. If you just put that intention into that body, physically where the body is, you're going to add order. You keep in mind the surface middle deep concept, and do your integration in the middle, you're going to add order. If you're not, especially if you're doing car wash type of massage, if you're not paying attention to 90, because people don't do that. People in massage schools and so forth, they don't see any importance in that. Well, conceptually, it's a pretty hard concept, and I think you're all to the point where you're starting to conceptually, on the right side of your brain, understand what I'm talking about. Now, I would prefer that you don't go out and try and lay all this stuff onto somebody else, your cohorts and partners, because it'll get so distorted in that translation. And I don't think this is stuff people should be out playing with. That's why there was only invitations given to this class. This was not open to the public. We brought in people that we thought we could trust with this type of work. It's only the second time I've put this work out there.
I got a couple of others.
Good, let's do it,
And these are just, really going to show how to...
There's no question that's ignorant, even if you think it is.
Again, I guess I would like verbally to hear and one more time, just a demonstration on what in sensei protocol or technique or tool or whatever you would want to call it. How would I define that for my left brain, if that can be done? And also the fulcrum set point, still point concept.
In sensate work, what I'm calling in sensate work is joint movement that the joint can't make itself. I-N-S-E-N-S-A-T-E.
I'm sorry, do that again.
I-N-S-E-N-S-A-T-E.
Joint movement.
It's joint movement that the joint can't do itself. Okay?
And so it's more than, it accomplishes more than what the joint, let's say somebody that had good range of motion, full activity, you're accomplishing more than that, you're creating more space, more openness for that person by doing that. And that was accomplished by, I know you had the stabilizing.
Let me go back.
Okay.
Think about a joint. Don't think of it as you're usually presented with it, with the skeleton and the two-dimensional functional anatomy. Don't think of it as bone rubbing on bone. Think of it as a place where articulation takes place. A place where the body opens. Okay? Think of the joint system as an entire system. If one joint shuts down, it affects the entire system. The joint system is never dealt with as a system.
So like
If it was, physical therapists, when you go in with a bum knee, wouldn't just work on that particular joint. It is a system. How can you have a freedom in your neck if your knees don't work right?
So one affects the whole is what you're saying.
Think of it as an entire system. If you have, think of the circulatory system. If you have something wrong in the distal part of the circulatory system, it affects the whole system. You were talking about phlebitis. If you've got phlebitis, the threat is to the whole system. Okay? It's the same thing. The joint system treated like a system. Okay? One of the things that happens is, if you can imagine all the tissue around a particular joint being like a balloon, collectively, the whole thing being like a balloon. And that as time goes on, and because of the way that you interact with your environment and so forth, that balloon starts to deflate. One of the things that I find that insensate movement does is it like blows it up on the inside. The balloon inside the joint blows up. And you're creating space. So what a joint is a joint is literally space. It's space where articulation takes place. It's not like a door hinge where there's two things doing this. Again, if you just look at the suspensory type of system in the body with the tensional fork, get away from the idea of column support, all of a sudden a whole new dimension opens up to you, where bones aren't banging on bones. If you think about it, that's an impossibility. And, you know, that's why cartilage gets blown out, and discs and things like that, and there's bursa problems, because part of our concept of the world is based on column supports. So we're projecting that into the world and onto our own bodies. So you need to have a feeling in your body of suspensory type of resiliency.
And that's where you're thinking, so your image then is of the core and the sleeve rather than of the column support.
Yes, yes. And those joints, don't think of them as Think of it like this. That's a joint. That's a knee joint. The bone should float in a sea of flesh. That's a knee joint, okay? Not this, okay? It's this. And what adds this? The ligaments, we always blow the ligaments out in the knees and so forth. Well, it's the relationship from here to the ankle that stabilizes the knee. Okay? And I know that from my own experience. I got a knee that before I got Rolfed, if I relaxed the quadriceps, it would fall out of joint. I've got no ligaments, no cartilages, nothing holding the knee together. It used to fall out of joint, maybe 2-3 times a week. I'd walk through a door and down I'd go. I'd just go down, fall downstairs, you know. All I needed was a bozo costume, you know. A life of pratfalls. And when I got Rolfed, it quit doing that. Now, if I want to throw my knee out, all I have to do is do some real fast, violent twisting. I'm sure it won't maintain itself to that standard. But normal, everyday walking and so forth, it doesn't fall out. I don't even hardly think about it anymore. And that's only because what the Rolfer did is change the relationship from here to here. And the relationship of the soft tissue has created stability for me. So all of a sudden I'm thinking, well, hell, stability in a joint in a knee joint isn't dependent on the cruciate ligaments. And if you think about it, that would really be a pretty fragile system. So athletes and so forth that are blowing out their knees before they did their sport, and if appropriate relationship from here to the ankle was established, maybe they wouldn't blow out their knees so much. Maybe all the torque and everything else wouldn't go to the knee joint this way. So think of a joint like this. Stability comes from relationship. And under stress and torque of an athletic event, when you bypass this, that's what the ligaments are for. The ligaments and all that are supposed to then stabilize it. I don't think that ligaments and so forth in joint systems are the primary stabilizers. Just like I don't think that this space in a spine is the primary supporting mechanism. I think it's the small muscles that we talked about, and it's the relationship of where that spine is in three-dimensional space in the body. It's that creates length, and then those discs are shock absorbers. As you go through life and something happens and you come down, there's a shock absorber there. It's not the primary supporting structure we talked about before. Just go down to the local gas station here and have them take the springs off your car and see how long your shocks last. Does that make sense? But it's a different view of the body. And if you approach the body with a different view, you're going to do different things in your work. And what else was your part of your
the second part of that would be then just again a demonstration in one part, the anchoring and how to accomplish this movement, this insensate movement. What key things?
Or the thing that I'm calling still point.
Well, I was thinking of still point, that I associated that with more like what you were doing when you got under people's backs, and insensate where you're kind of anchoring one area and gently suggesting movement.
Let me show you a still point in the arm.
Okay.
You can do still points everywhere, but what I'm calling still points, you can do them everywhere.
Right, that's what we were doing in the, like on the shoulders and everything.
Here, lay down on your back, I'll show you one. Here, I'll show you one.
But is a
You can make
still
this
point-
stuff up if you have the concepts, you understand? There's no protocol, I want to say that again. There's no protocol.
Is a still point different technique or
Yeah.
tool different than an insensate?
Yeah.
That's what I wanted to
Yeah.
see, the difference again and how.
Okay, lay on your back. Good.
Maybe you should pick something else, I don't know, so I can see what you're doing.
No, I want you to feel it. I want you to see it. You wanna open up a joint, like the elbow? The only thing I'm doing here is I'm just controlling rotation. I'm not doing anything. except
You're
controlling-
anchoring on
Yeah, I'm
humerus
controlling
up
rotation,
here.
so this doesn't
Okay.
happen, okay? I'm creating a fulcrum here.
So you're using your fulcrum here also,
Yeah.
too, as well as anchoring your fulcrum.
Yeah, well, I'm just keeping it from rotating. I'm controlling what's happening up here with that, okay? Now, this is a hell of a lot more subtle than what we were doing with the head. In the quote. Right there it is, that's it. Okay.
And so you were gently
wait,
teasing
wait.
that to open that,
Wait,
I
wait.
could feel, okay.
No, I didn't open it, you opened it. A little different.
Wait a minute, I'm not kidding.
Well, this one's longer for one thing. Look where it's sitting here. Further back. Do the same thing here. Good, the elbow joint, I got a hold of the elbow joint, right? Which is from here to here.
It feels like, Tony, the teasing is mainly downward. Can you tease it upward and downward and upward and downward? I mean, if that seems like what needs to be done? Or do you always go in one direction?
I don't understand the question. What?
She wants to know if.
If I don't, oh,
Can you create direction with what you're doing? If your intention is to go this way, fine.
My intention,
Go
yeah,
this
okay,
way,
my
fine.
intention isn't directional like that. My intention is for length to take place in the joint, right here, okay? And my focus is from here to here. I'm also focusing on our axis because this has to relate to the axis. So I'm aware of all of it. So I've got a hold of a relationship not only having to do with length across the joint here, but I'm also dealing with the joint in relationship to the axis.
I guess what I'm thinking of, is like, and this is probably one opinion, like a cork in a bottle, and you can, you've got a hold of the bottle, you're anchoring it, and you'll pull it out, but sometimes you need to push it down a little bit, and then pull it out, and push it down.
That's
and pull
insensate.
it. And so
That's insensate.
So this is
Right.
like that also, and you don't need to do,
No, no.
sometimes you may accomplish this by going one way, but sometimes
Yeah.
you may need to go both ways, or even
Like on the
sideways.
fibula yesterday, the one that I had to wiggle a little bit this way
Okay.
and a little bit this way, and then it came down. And then it went back up a little bit, and then it came down to where I thought it should be, and then it went back up like I thought it should.
Yeah, that would be the rubber band in the drawing. Right.
No, if it's your opening too between the bones there, no?
I wasn't
Well,
doing
it
any
looks like
sensing.
you were moving it to the side.
Yeah, I probably was. Yeah, what I was dealing with is I was dealing with the connection through here.
So this is not still point.
Yeah, this is.
This is still point, isn't intensive.
This isn't intensive. What I'm doing is, on the drawing of the rubber band through the tube, the rubber band's twisted. So I'm letting it come out this way so that it can open this way. I don't want it to open around the twist, that's what I'm doing. Okay?
Okay, then that was still point, and insensate would be what? The, and that's applying pressure.
Put your radio head and do this.
Okay.
Now that opens the next page.
It's like going up the balloon.
And usually for that, are you on the end of either, like the origins and the insertion of the bone?
Stabilize it,
Just
stabilize. Stabilize one so it doesn't move and take the other one and move it. And it's a deep, subtle, quiet event. It's not this. It's real deep. And I'm not talking about large movement. Can I answer your question?
Yes, thank you.
Anything else?
More dear.
Sure, thank you.
Anything else?
Hi, Julie, I thought about the questionnaire history, or the health history yesterday. What about exercise? What role does exercise and what type of exercise would you suggest?
I think it's important to know what they do and when they do it, so you can plan your treatment and intervention accordingly. If somebody leaves your office and goes out and runs, it's 8 miles. That's not good. I wouldn't advise anybody on exercise. I recommend everybody they buy Anderson's stretching book, Bob Anderson's book called Stretching.
Oh, yeah, that brought to mind yesterday because you were saying, when you were talking about something, and maybe I misunderstood you, as part of pulling in terms of a gentle stretch, you wouldn't recommend that then at the end of whatever you're doing, again, to help to maintain the length or whatever?
I mean, you physically stretching them?
Right.
Be careful when you stretch people too, because if you stretch into the danger zone, the stress receptors will shorten it up anyway.
Is there a safe level though, if you go with what they can do and what you're sensing and what they're telling you, you still wouldn't stretch things at the end?
I don't
Would you
understand,
say-
what do you want to stretch at the end of what?
Okay, for instance, let's say you've worked on the neck, you've softened up the muscles, and you want to gently maybe give it some direction this way and some
Oh, taking it
direction that
through a
way.
range of motion. Taking it through a
Right,
range of motion.
but also with gentle traction. There's some stretching involved also. It's not just putting it through range of motion.
That's fine. I mean, that's like, is an ephrologian kit. That's fine, it's part of your massage, it's fine.
I wasn't sure yesterday when we were talking about not stretching, whether you thought that was...
No, what I'm saying is, if you pull things, 90% of the time they're going to shorten on you after you're done pulling on them. Realize that. You're better off going into something and then just gently letting it come out, rather than taking some. Don't take a neck and pull it like this. Don't do that. Traction in a hospital situation where somebody's blown a disc or something, they put them in traction. That's for, a long time. It's hours, days.
And actually,
Okay, which is different than taking and pulling on the neck.
But
Okay?
what about stretching?
The other thing is,
The
be
stretching
careful
that
at the
gives
end of a
those
massage,
kinds of things.
don't do this to somebody. Some people, again, that's car wash massage. Some people, you just do this to them and you just do the whole massage. You give them that forward stretch. A lot of
I
people,
do that all the time.
well, again, ask yourself the question, why am I doing it?
Well, again, I guess I look at it as a passive stretch. I mean, it's like, they're leaning into my arms, giving me some pressure, taking a deep breath, and on the release of the breath, like they've relaxed, and you've added, again, like, I guess I think I'm adding length to it when I
Somebody
do
lay
it.
down.
Boy, I'm a real car wash blower outer.
What's the most important thing?
No, somebody else lay down. I want you to watch this. Somebody else lay down. No.
Well,
Somebody
What's real
else.
important is you're real open. And a lot of people probably wouldn't think to say this to Tony. It's good that you're open.
Okay, now, let's say it's the end of a massage, you got them up this way, and this person is like that.
Okay, now what if they're not like that? What if they're like that?
Then what more do you want out of that neck?
That was more lengthening than the way Tony's had it.
You're gonna find people that are so short, at the end of the massage, they're gonna be looking back this way. To them, that's normal. That feels normal.
Okay, so you don't add any length then, or you're not accomplishing anything you don't think. If after you've worked and softened the area, your head is resting down, to have them take a deep breath and then maybe just go like that.
That might feel wonderful, that might be great.
But you
I
think
don't
it
know.
could be dangerous also?
Oh, that didn't look like a lot of traction. It's when you take the vertebrae and think that you're gonna lengthen the neck by pulling them apart, at that level of intention, you are wrong.
Or what about the side movements, where again,
It looks like old-time Swedish massage to me.
okay, so that's
That's
not what
fine.
you're talking
It's
about.
not what I'm talking
You're
about at
talking
all.
about lifting the head.
I'm talking about people that say, think in their mind, this neck is jammed up, those vertebrae have to come apart, and then they pull it real hard and think that they're pulling the vertebrae apart and doing a service, and they're not.
Okay, with, like, then you would disagree, you would not think this is good. Again, it's like she leaned gently into my arms and took a deep breath. And then release the pressure and release the breath and come out.
That might be good for some people. To do it blanketly, you're gonna find people that'll you'll
It'll
blow
make
the
it
whole
worse.
massage.
You'll make it worse.
Yep, you'll blow the whole massage. But you have to know why you're doing it.
So if you maybe felt that it was okay?
If you've got somebody that is like this, okay? That's the way they are, okay? Where do they need length? Maybe. Maybe where they need length, the reason they're short is they're short in here behind the sternum, in front of the spine. That's a good time to reach in here and do one of these jobs.
Do you think by doing that, you maintain maybe more of the loosening and the softening that you've done? Just like
Yeah.
Anderson was stretching afterwards. I mean, aren't you helping them to maintain?
What's the most important thing in
Anderson?
Anderson's book when he talks about the fascial planes and he talks about the danger zone? For a person, for her, danger zone isn't going to start till way beyond this, okay? For the person that comes into your office and at the end of the massage they're like that, all you have to do is go to here and you're into the danger zone already.
Okay, thanks.
Okay? What I'm saying is, and then you maybe get all disappointed because at the end they still look like this. Maybe where you need to get the length is in here, in the center of the inside tube. And then you set up a situation where the rubber band has to lengthen here. You follow? Okay. That's what I'm saying. How many people have seen people like this? Well, yeah. And you can do all kinds of things to their neck, and it's not going to change it. You're going to change it from in here. Deep.
So then, like, maybe you're really having problems with the neck, and I'm talking like real short necks,
Yep.
then you would maybe want to start down with some of that set point that you were talking, where you're going to start down here again.
Demand that it get long in here. Demands that's too
really
strong of a
harsh.
term. Yeah, that's too strong of a term.
That sounds controlling.
But you are. It is controlling. You're setting up a situation so that if they're going to lengthen any place, they're only going to lengthen where you have set up the control. You've controlled everything so that it can only lengthen in one place.
And again, how do you judge in here where your placement is underneath? By observation, but I'm still unclear of that.
You wouldn't do this here on her. That is not. I mean, you can look at her and see that's not where she needs it. You know, what does that do? That drives the lumbars forward. As soon as you put your hands there, she loses the whole pelvis, the inside line of the legs. If I come up in here, no, that's still driving it forward. The lumbars are going towards the ceiling. Now here, right there, the lumbars have to drop back in order for her to get long. They have to let go. You see?
That's the key to having the lumbars drop back.
When I got a hold of this weight, where's the other end of the weight? It's in the pelvis. Okay? It's in the pelvis. I'm controlling one end of it.
I want physics.
I didn't do very well at it either. that either. For her, it may be between the shoulder blades. Somebody else, you may want to do it down here. But if the more aware you are, the more you're going to see it. Now, let me go back to one other thing. Do you see the importance of knowing the observer?
Yeah.
It's the only way you can get out of the way. Because all of this is just getting in your own way. That's the importance of the observer, or the witness. You have to know the witness. If not, the left side of your brain is going to drive you nuts. Now, you don't, like I say, you don't put flowers in your hair and go New Age on us and suck this all out of your thumb. That isn't what you're doing either. It comes down to hardcore flesh. You can get as ethereal and metaphysical as you want on one side, but when you put your hands on somebody, you come right smack dab into the reality of the flesh. It's the reality of it. Then you get all real secure in a bunch of stories that you tell yourself on the left side of your brain. Then you start doing car wash. And then we try to get you over to the right side of your brain, and the left side of the brain turns into a critic, when the right side of the brain is trying to be an artist. So what I really haven't given you a gift. What I've given you is a big pain in the ass. Okay? It's a big pain in the ass. It would be wonderful. That's why we didn't throw this open to the public. You understand me? And if we make these tapes available to you, I don't want them shared with anybody else.
Are we getting paid?
Well, we're going to see. Maybe. Maybe. We'll see how these work out, okay? Do you understand what I'm saying? So this has been a trick. You know, you thought you were going to have something secure to stand on, and I put you on a surfboard. Okay?
I got another question.
Go ahead. This is great.
Okay, now, sometimes I have a lot of problem, intention. I mean, I may know what I'm doing, what I'm needing, what I'm trying to accomplish, but sometimes, would you mind, watching for just a minute? And I think I might have missed what you said. Okay. Just like sometimes I find a response to this, when I do this, but I really don't know what my intention is, other in very broad terms of, I want to open this up, or soften this up, or make this person less rigid. So let's say I'm doing something like that. I mean, can you think thoughts in your head, when you're doing things like that, because you are feeling a responsive tissue, but I don't really know what my intention is. Maybe I'm doing nothing here. Maybe I'm lollying here. I mean, how do I know what my intention is? And yet people say,
Your left brain is telling you, is being your critic now. Okay. Okay, Kathy, now we're going to evaluate you. No, you're lollygagging. You get an F. That's the left side of the brain.
But I have trouble visualizing an intention other than just being real vague in my mind.
Stay in the flesh. Stay in the flesh. You got your hands on flesh.
And just as long as I'm doing that, maybe that's okay then?
It's okay. The other thing is, it's very helpful to have the witness. Because the witness can watch all that. And you can lollygag all you want.
Okay, great.
Okay? Okay? You know what I'm saying?
Kind of. I mean, I just, intention to me has like a goal or a real intent in mind rather than...
We'll go back to the things that we talked about intention. Okay?
But like I don't have
Clear
any knowledge,
visualization.
I don't have any clear knowledge or visualization of what's going on. I just have the response in my hands that something's going on, but I don't know what.
What do I want to come of this? That's a real good one. Put you on task. And if you find the witness will keep you focused. What do I want to come of this? Then you take your hands off of her and you say, what came of this?
second, yeah.
What do I want to come of this? What meaningful can I evoke from this form? Not this piece of meat, this form. Okay? Not this bicep femoris. This form. As soon as I take it into form, it's no longer a bicep femoris. It's a relationship to the tibialis anterior. It's a relationship to the psoas. It's a relationship to the rhomboids. It's a relationship to the scalenes and the roof of the mouth, which also has to relate down to the arches of the feet. And I haven't moved my hands from where you are.
So I've got to keep all that in mind.
But at one level, you got a hold of a bicep femoris. At another level, you've got a hold of that whole chain of relationships. You don't have a hold of a bicep femoris. You have a hold of part of a relationship. You're not even part of a relationship. You have a hold of the relationship. If you change something there, you change the relationship. You follow?
Just one more question.
Okay.
Since we're here. Now, hers are really nice, but one of the things I really have trouble with intention and even knowing what to do with either the set point or extension help with that. Like with the tensor fascial lateral, you just feel this really tight band down people. And this, it seems like no matter what I do, a lot of times
That's another one of those.
I'm not doing anything.
That's-
it's still
That's
there.
another one of those
It's
parts of
there.
the body that's, you need a chainsaw to even cut through, I guess. Well, any of the Swedish massage techniques are wonderful for that.
And so just keep doing them then.
Yeah. It's like an Eskimo chewing on an old piece of leather, Eventually, he's going to make some nice soft moccasins out of it.
Okay.
You know?
That's a new technique of bite. The gum. I'll try that next time. This guy I saw for massage says you chew on it just like that.
Stay out of the way.
You had your tetanus shot here. Thank you.
Anything else?
I guess I'm confused as far as in the insensate work, as far as the relating of it to the core. I'm not sure I fully appreciate that.
When you do insensate work and you do just this much movement in a joint, just that much, the smallest amount of movement you can imagine in a joint, where is the movement at? Where's the change at? Where's Charles's legs? If I do an insensate movement on this knee and I get just the tiny, smallest amount of movement you can think of, where does that movement take place?
What takes place in the knee itself.
But where? Where in that joint? Right in the center of the damn thing, right here. How you can't get any deeper than that.
Okay, what I'm asking is a little different. For example, when you were working on, I'm not sure who it was, just laying on a table. When you're working on an elbow, you said you were relating it to this core. That's where I'm missing the connection. How?
Axial appendicular. Axial appendicular. Remember we talked about axial appendicular? It's one of the part of the conceptual anatomy stuff. That whole unit of the arm and shoulder girdle, okay? The only place that articulates with the bony part is here, right? The whole thing is a yoke and is related to and dependent on an axis.
I understand all that. I guess I'm just not understanding how what you were doing related to the core.
I think what he's trying to say
Help
is
me.
that when you had a reaction in one part, you will have a reaction somewhere else. And when he's relating it to the core. And just just because you're working on the hand, you might have a reaction in the back on the foot. You will have a reaction somewhere else, and what he's trying to say is keep the reaction to the core. Does that help?
The focus is the depth of the core, it's not right where you are, it's not right there.
The only thing I would add to both of those is that the focus is the relationship of the axial to the appendicular, and how the appendicular is impinging on the axis and vice versa. Is the problem you're seeing in getting the length that you want in an elbow, is that because the axis is short? Because there's no integrity in the axis. Maybe you'll get the length that you, or maybe you'll get the change in an elbow that you want by changing something in the core. Okay? Go back to the analogy of the tent and the tent pole. Okay? If the ropes on the tent are too slack, well, we can go around and tighten them all, right? Or maybe we can just take the tent pole and make it longer and tighten up all the ropes that way. Okay?
That was after lunch, I think, and we came in late.
No, if I was your dad, I would.
Oh.
You're talking about the tent.
I came in late.
Is this where balance comes in then, if the focus is on the relationship of the
Then
axial
you-
to the
if you're-
appendicular, you're looking for this balance?
If you start to work in space and start to work in relationships rather than things, okay, then you're working for balance. When you start working on biceps and triceps and take a reductionist view and take our friend apart down to his smallest parts, then you're working towards symmetry. Okay? And you're never going to get it. You can get balance, but you can't get symmetry. Unless you can create another stomach on the other side that's just like the one over here and another liver. Because we are not symmetrical things. We're things that are balanced. We're not symmetrical.
That's what you were trying to point out to me the other day when I was working at the gym, that I was in the clavicle, and you
Yeah,
said...
you were going for symmetry, yeah.
And you said, no.
Okay, yeah, but I understand that. Okay, but, and so you're looking at the appendicular and the axial. Now this balance, let's say you have somebody, let's say, that still has a permanent paralysis, and maybe they have to use an appliance or a cane or whatever. What is balance for them still achieving this core? I mean, can that
Absolutely.
happen? Can that
Absolutely.
happen then?
It's always this. Remember we started with the wheel point.
So even though things are really still lopsided, you can
we
get
start-
this core to come up and achieve balance.
If we start with a wheel point, okay, we're creating a plane. Vectors can't exist without planes either, okay? So immediately, as long as we've done this, we've created a 90-degree angle. It's a 90-degree angle, right there. Okay? 90-degree angle. You got the earth here. All right? And you have arches because you're standing on a ball. Okay? Right down to the center, and it does a 90. So you're always dealing with a vertical axis and horizontal relationships. You're always dealing with 90-degree angles. They're all 90-degree angles. Or 180-degree relationship to a vertical.
So is that what we're looking for at the body then, when we're looking for that balance, looking at a 90-degree angle to see
But, and it's real, yeah, and it's real simple. When they're laying on the table and you're working on a foot, don't work with it out here. How can you add any order to that body that way? Where's the horizontal? Your horizontal hinges. All the way up the spine. You show me where there isn't a horizontal hinge, and where the 90 degrees isn't relating to a vertical axis. You know, where is it? They're all horizontal hinges. They're 90-degree jobs right here. So what you have to do is honor that. That's all you have to do is honor that.
I'm thinking of someone who had surgeries for curvature of the spine when they were younger, and I can't even tell what the spine is because their back is so disfigured and it's
What kind of surgery?
I don't
The
know.
claws or the Harrington rods or?
I'm not sure what they had. They also had surgery on the arm, so they kind of look like this.
Okay, what can you hope for that person? They look like this. What can you hope for? You can hope for an axis of support, okay? And you can relate as best you can horizontally. So when you're working on it, if that's anatomically what's happening, then you've got to have enough here so that you have the vertical, and then maybe that 90 degrees is down here rather than across here. Okay? I didn't tell you this was easy. It's not. You know why it isn't easy? Because it takes the responsibility and throws it on you. And that's a bitch because you got to go out and learn some more stuff. Okay? Then after you go out and learn some more stuff, it's going to create more questions for you. And you're going to get uncomfortable.
So that,
And then what comes up then? All your self-doubts, all your fears, and all of that other stuff. Okay? So maybe you go into psychotherapy then, and maybe your massage is going to get better. Because you change. The other thing you need to do in terms of self-care is make sure that you're involved in some kind of movement work. Those of you that have been Rolfed, if you haven't done the Rolf movement work, it can be extremely powerful. And it can be extremely helpful for massage people especially. It's powerful work. It's real subtle work. It tends to be more emotional than the Rolfing work. In terms of the process on the table, it tends to be extremely emotional work. I think if you're going to make a career out of massage, you ought to be doing movement work. If not the Rolf movement work, there is other forms. More forms cropping up. Get involved with the Gurdjieffian group. There's a whole movement series of moving meditations there. They hold those pretty secret, and you have to, join the club. But what else? Tai Chi, but you see, Tai Chi is an Oriental form. Those people can sit in squatted positions forever, and they can be on their knees forever. You have to make some sort of structural adaptation to do Tai Chi as a Westerner, as an Eastern European. All the martial arts have a particular form that goes into the body. And if you study both, what body form and personality and so forth mean, you can pretty much tell somebody, if they say, well, here's 10 people that are in a martial art, what are the martial arts? Well, this one's Tai Chi, this one's Karate, this one's Judo. They all take on different forms. For the Westerner, particularly. It's harder to tell with the Orientals. Those forms came out of Oriental bodies, you understand? So what we do is we take something that has come out of Oriental bodies and impose it upon an Eastern European body. So you have to make accommodations someplace. Okay? Alexander work is wonderful. If you find a good Alexander practitioner, that's great. Feldenkrais work is great, but if you've been Rolfed, you're going to find that there's a conflict there. Now, there are a few people that are working at and are being rather successful at resolving that conflict. But it takes theoretical give and take that most people haven't put the time into, including Moshe Feldenkrais and Ida Rolf. They thought that they were great friends, by the way. Now, Fritz Perls and Ida Rolf had a lot of respect for each other, but they didn't like each other. It was a real different type of relationship between Fritz and Ida, and between Moshe and Ida. Moshe and Ida were extremely close friends. And they actually thought that Ida's work was structural integration, and Moshe, what do you call his? It was functional integration. So from the language, it sounds like they should go together. But they had a problem. And the problem was, as I understand it, focuses around the 90-degree angle and horizontals. And that Moshe focused more on horizontals than verticals. And so what they did is they took a bunch of Rolfers who had had tons of Rolfing, and they took them through Feldenkrais work for a week, and they all felt like they were this big.
Yeah.
They all shortened. The Feldenkrais work made them feel short. And Moshe and Ida looked at each other and said, yeah, they look like they're this big. And so they just parted and felt that someday, theoretically, they could come together. I think the other part about Moshe's work is he didn't have the vehicle, the ritualized vehicle to pass his work on, like he did. Okay, I don't think he found a vehicle to give it all up. Now, Ida always wanted to go back to being a researcher, and she'd have paid anybody if she could just give it up. You know? It was a burden to her. It wasn't something she says, well, now I'm going to start Rolfing, and now I'm going to do this. You know, it was like, God, what is this stuff? Why can't I give it away to anybody? And then I'll go back to being a researcher. She was like that till the day she died.
So what you were saying then, just a second to go back to like Tai Chi or some of the Oriental things, that if you use that as a vehicle to increase your fluidity or your motion and even comfort, that it is possible because we are Western rather than Eastern or whatever, it could create some conflict? I mean, you wouldn't feel comfortable in dealing with it?
No, you're going to have to make some accommodations that an Oriental body wouldn't have to make. Now, if you make those accommodations, you may feel very comfortable in that. And that may translate into your massage very well. The only thing I caution, yeah, it could take a lot of time, and it could create some conflict. And the reason I'm saying that is, be aware not to mix apples and oranges too. If you make a commitment to a form, stay to that commitment. Don't go do a little bit of Alexander work, and I do a little Feldenkrais, and then I do a little yoga. You know, make a commitment to a form. Things will be fine. You know, most of the Oriental stuff is based on circles. What are circles? Circles are a 90-degree angle in motion. That's the geometric. What I just gave you is the geometric explanation of Oriental religions and philosophies. You can reduce it all down to geometry anyway. You know, we can get real philosophical about what I just said about 90 degrees in motion. Okay? I mean, we could probably start a cult. Just like the foot cult we started. We'd go on television. Get donations. America, it's wonderful. Sam?
I'd like to relate to what I was reading, if you can speak on that. When you worked on rapid region, at first I felt an opening, and after that I began feeling disoriented and apprehension. I'm not really sure what is going on, but I found I had to, seek out my own way to balance that. So I went out the audience and chanting and just about bring it back together. So I'm not really sure what was happening.
I'm not either. Is it okay? You feel balanced now?
Yeah.
I think what he just said is wonderful. Here's somebody that what we did is we put, I can't think of a better word, please excuse me, demand We demanded that if he was going to lengthen, that he do it real deep in his thorax. He found it disorienting and had to go and take responsibility for that new space and integrate it into his life. You know, it's wonderful. You know, what more do you want? You know what I'm saying? What more intervention do you want in somebody's life than what you can do in just a few minutes like that? You know, you just saved him a lot of money in psychotherapy.
Right, yes, people like that.
Oh, you bet you. You betcha. You betcha. It's much easier to do car wash. Believe me. Much easier to do car wash.
The woman that I worked on, that I was talking about in the spine, the first time I worked on her, she'd never worked on before, and she came back, she goes, oh, I felt really good, my pain left, except, she goes, my emotions went crazy, and I was so angry at everybody, and I was, going, I said, well, that's from the
If
side.
you're gonna play in this area, even if you're doing car wash, what you have your hands on is the person's personality and soul. Aristotle said this. Now let me tell you this quote. This you want to, because you think of Aristotle thinking as that linear type of reductionist type of stuff. And listen to what Aristotle said. He said, a change in the state of the soul will result in a change in the shape of the body. Shape of the body. And conversely, a change in the shape of the body will result in a change in the state of the soul. Now that's pretty heavy, especially when your job is to put your hands on people.
My question is, what do you tell these people? I mean, do you warn them ahead of time? That's my question.
No, because then you're setting up a prophecy. Maybe you won't be able to make that kind of effect on somebody. You know.
So when they come back and say, well, geez, I don't understand what happened, then, then they're looking for, sometimes.
Your body is the reflection of who you are in the material world. If there was a change and you felt some relief there, there's going to be, consequently, there's going to be some emotional component to that. If you're having a hard time with that, I have a couple names of a psychotherapist that you can go and you can talk with about that.
Well, plus a lot of times
You
you
know?
really don't know what that person wants, what they're expecting, because they might come in with a preconceived idea of what they're going to benefit from or what's
That's
going
right.
to happen. So that really, it just overrides everything anyway.
How many of you have seen emotional stuff happen on your table? Okay.
It happens very often on the third day at the courthouse.
Well, yeah, by the
People
third day, you've done some order and organization to the surface, and you've started affecting the relationship between surface and deep.
But going back to Sam, the integration, this integration then is by the third or the second person, by the client or whatever. This integration is by them, not by the therapist. Basically, a person does their own integration, and it may happen as quickly as it did for Sam, or it
But
can go on for weeks or months.
If it goes
or
on for
whatever.
weeks, it isn't integrating. You didn't set up the situation. No, you haven't set up the situation.
How long, I know you can't say how, 1 week or 3 days, but I mean, in terms of integration, how long can it take? Or if it takes longer than for that person, coming from own personal experience, then to feel a change and to feel, yes, something was lifted, and if that's gone on for 3 weeks, what, it's really sunk back to its old self then? It's not really
You may do that too.
integration?
It may do that too. The old patterns will repeat. And the reason that people go to the old patterns is because the new is so scary, because what's happening when you all of a sudden start to discover an axis, you're discovering maximum degrees of freedom. All the options are open to you.
So like, what's the maximum length of time,
You start
that you would say
opening-
for integration to take place?
Well, it depends on the person. I can't give you the, 4
No, I know,
days
I
and
understand
4
that,
days and
but-
3 nights.
But you're
No.
saying if it takes, but you just said though, if it takes 2 or 3 weeks or whatever,
integration hasn't taken
If
place.
it takes whatever you would consider, in your professional opinion, and it's taking an extensive period of time, I would take another look at the relationship between the axis and the appendicular, the core and the sleeve, and I would go for balance there, inside to out. When it's like if you build a soapbox racer to enter into the soapbox derby, and you've got the front wheels over here, and then the back wheels are over here, and you send it down the hill, you're going to get down to the other end of the hill, but the way you get down there is not going to be the same as if you move the wheels over in front of the other ones.
But even like Rolfing, a year or so is recommended, like you say, after 10 sessions. Isn't that a chance for, that's not a chance, I always looked at that as a chance for further integration to take used to this new form and getting used to it. So
after somebody finishes 10 sessions of Rolfing, their body is going to continue to shift and change for 6 months to a year, maybe longer.
Okay, so that's what I guess
Maybe
I was
longer.
trying to understand.
Maybe longer. That's you make up a rule, you've lied to yourself. You know, that's the thing about car wash. Any car wash approach to any kind of intervention. It's a lie. It's a story you made up. It's a story you made up to keep yourself comfortable. So we've opened up a bag of worms for you. We've put you into another dimension. You know, hopefully what we've done is we've put you into a dimension where there aren't any answers. There's only questions. Okay?
Is there anybody else that needs to hear the 90-degree angle beside me?
What do you need to hear?
Well, I just don't understand. I just was in the bathroom when you went through that. Is that it?
Somebody else explain it. I'm tired of talking about it.
Well, it's basically we exist. You have a starting point, the center or whatever, and anything out there, it's like if I look, there's the wall out there. Okay, there's a wall right there. I see you. It's like everything faces my center. So everything, I'm relating to everything. It's a plane. Everything's a plane that I'm relating to, but I'm relating to it to my center. So it's a 90-degree angle from my center to that plane that's up.
Well, I think the correlation that might make most sense to lower body in general is how it relates to the body, like when you're working out an area, seeing 90 degree, where you're looking at to get that 90-degree balanced view. You see what I'm saying? Using your own body to demonstrate.
Little point in your act.
What's one of the most powerful symbols in religions in the world?
Cross.
I have got the neatest paper.
Why? Why? Have you ever looked into the metaphysics of why that was part of it?
This is.
What does it mean? Right. What's the earth plane? How do you, well, it's horizontal, isn't it? It's a 90-degree angle. That's the earth plane. That's the fall into the flesh. I recommend you all read a book called The Time Falling Bodies Take to Light by William Irwin Thompson. Okay, The Time Falling Bodies Take to Light. Mythology, Sexuality, and the Origins of Culture. William Irwin Thompson. Published in 1982, I believe.
Light or light?
Light, L-I-G-H-T. The Time Falling Bodies Take to Light. William Irwin Thompson. Okay, so this is the earth plane, okay? When you think, how do you think? Vertically or horizontally? How do we depict time and space? Horizontally. How do we do it? Right to left or left to right? You're taking too much yoga. Huh? Yeah, it's left to right. However, if you go into the Hebrew and read the book of formations, you'll understand why you do that. Because you'll understand why the body faces the way it does in relationship to that center. Okay? Okay, what about the vertical? What did I say about the core? It's being, that's spirit. Okay? There isn't any time there. That's the here and now. If you live in that, all your options are open to you. It's a direct pipeline to spirit or greater consciousness, if you will. Or, you know, if you aren't in that kind of bent, it doesn't make any difference. Then you can just take it and look at it from the physics point of view. All right? But there's no time in this vertical place. That's spirit. Time is created along a horizontal plane. So, if you are going to be in the flesh, and that's why we're here, you know, if you want to get all spiritual, and you'll have clients that do this, you know, they're going to, you know, eat grubs and, dandelion leaves and live on that and sit in a lotus all day and hum, okay? They might as well die. If you want to be that spiritual, go do it. But don't stay in the flesh. Because that's where they're headed, okay? I personally think the trip of being in the flesh is to work it out in the flesh. That's why we fell into this body and we fell into the material plane anyway. So, what you have to do is you have to resolve the relationship between vertical and horizontal. You have to come to grips with a 90-degree angle. That's what it is. And all your power has to be a 90-degree angle. It has to come geometrically to 90 degrees. That is the resolution of spirit and flesh. And it's reflected in your, it has to be reflected in your tissue, doesn't it? The only thing I'm saying is when you're massaging somebody, honor that. And honor it in your own body.
I don't know, does this relate to it? It opened up new images for me, and can this be incorporated? I've tried, because it seemed important to me, into the work of the flesh, going back to the sign of the cross. In this visualization, it talked about honoring the feminine side. Again, taking into the feminine and the masculine side as you bring your right hand over to this horizontal plane. Think of your symbolic, your creative, that side of you, and here your intuitive, and here your analytic, your power, your whatever. Is there a way to incorporate that, or do you see, when you work with bodies, do you think of those kinds of energies and balancing that also, and would that be apparent in working in your intention?
No, I don't.
Your intention?
I don't. I'm aware of that, but my experience is that most of that is role choice. And that I don't buy that the right side of the body is this and the left side of the body is that, because all of that is a spiral. It's all happening at once. Okay, then when you start dealing with that, you have to start dealing with the relationship of the vertical and the horizontal in relationship to gravity, which is a spiral, which takes us to the law, the universal law of cyclicity. It means you go all the way around and come back, but you're at a different level. And then it comes around this way. That's how Dan Winter can say that emotions are, your emotions are created by gravity. Okay? I have a lot of trouble with people that make up the rule that this side of the body is masculine and this side of the body is feminine. I don't find that at all. I think we're all, oh boy, I'm really going to put my foot down. I think that all power is feminine. That's what I think. I think that that's all there is female. I think that male power, what we think is power, is basically aggression. Okay? And I don't think aggression is power. There's no magic there. I think that's why priests dress up in dresses. If if you read, you know, the Pope was in drag the whole time he was here. Nobody even commented on it. But I think, well, of course, judges, okay? Well, yeah, in England, I think they still do that too. They wear wigs, for God's sakes, in England, don't they? That's a holdover from when male aggression took the matriarchal society and said, hey, we just discovered that we got some part in this paternity stuff. You know? That this magic of you having babies, we got part of this. And you created all this grain and storehouse of grain, and now we're going to fight to protect it from these other males.
That would take exception, though. Masculine and feminine does not necessarily mean male and female.
No. It is in the vernacular that's generally used daily when we're talking about it. Okay? You know, I think that the last card of the major arcana of the tarot is an androgynous figure. I mean, that's the object of the exercise.
Yeah, well, spirit is genderless. I mean, you still have the
It's androgynous, I think. But I think that my personal opinion is that all power is feminine. But that's where, if there's any magic, it's in feminine power. But that's something we could fight about that forever. People love to fight. People love to fight with me in the family. Anything else?
When Kathy was on the table here and you were looking at her arms, you mentioned something about the axis and the appendicular in relationship to her lying flat, and it confused me as to what exactly you were referring to. You were referring to her collarbone and coming down parallel to her body.
Yeah. What's appendicular? Here, relationship to the axis. This whole
thing is the
this whole yoke.
is the appendicular and the axis was the, okay.
Because it articulates with this.
It confused me.
Think of the cross.
As opposed to not standing up vertical horizontal.
Think of the cross. Okay.
Okay.
You know,
That's what I thought
how is this
you meant, but I
relating to
wasn't
this?
sure.
Okay. How is this relating to that? Any other questions about what we've done so far? Well, let's take a break and then get into some of the self-care stuff that I want to talk about, and then I want to have some time for you to work, and then we're going to take both video cameras and go around and get some shots of you moving around so that you can see that if that's what you want. Well, we can talk about how you want to finish this day up.
I have a question, it's just something.
Well, let's take a break first.
It doesn't have to do with the class, it has to do with preparing a massage table. I do have clients that are out of my house, so I take my massage table to their home. And it's real possible that I'm messing up my body carrying a massage table. I guess I'm...
Carry it in your right hand, too.
No, I switch it purposely each time. I mean, I make a point of, if I carry it in the house on the right side, then I carry it out on the left side. So that I do that. I don't do any right-handed sports.
I hope you charge them a lot more when you go to their house. Okay.
$20.
Oh, I think it's $30 if they carry the massage table.
Well,
$30 if I carry it.
I mean, maybe that I shouldn't, that's not for my highest good and I won't do it. That's really why I'm asking you. If there is, if I can have you give me an idea, just holding it up and just what is a more effective way. I try and think
There isn't a good way to carry a massage table. I'm not trying to be flippant here.
No, I appreciate that.
I really don't think there is, because you got to do this.
I have the case.
You got to do it this way. There really isn't a good way to do it. There's not a good way to carry it.
Is there a good way to attach a shoulder strap to it?
Oh, I have a shoulder strap. I have a great thing from the company. And it has a handle and everything. It has a shoulder strap with a handle.
What about wheels on the bottom? Rolling.
She'd still have to lift it in and out of the car.
Yeah, we getting it in and out of the car is the bear.
Yeah, that's right.
Charge it more. Contingencies of power. so that when you enter into a relationship with anybody, they come into your office, they lay down on your table, you enter into a relationship with anybody, there is an exchange of power. Okay, we know down at the cellular level there actually is atoms and molecules that are in their body that become part of your body and vice versa. But there is an exchange of personal power that takes place. And it will fall into, initially, will fall into one of 5 categories. Now you can apply this to your relationship with lovers and spouses. We could probably take it into the relationships in the body too. But these contingency, what I mean by contingency is you enter into a relationship with another person and the relationship becomes contingent on this exchange of power. Okay? The first one we call reward power. Reward power. The relationship becomes contingent on one person wanting or needing the reward that another person has. From your angle, you could be maintaining the relationship because these people come in and give you $50 for a massage. They could be doing it because you stroke them and tell them how wonderful they are. There's a reward. And the thing that you need to realize is the relationship is based on reward power contingency. If I'm out on a desert and you got a canteen of water, we will maintain our relationship based on the reward that you have, that I want. And you could probably get me to do a lot of things. You thirsty? Let's see a cartoon. Oh, that's good. Here. Okay? One of the interesting, well, I'll get back to this. Let's talk about all 5 of these. The other one's coercive. Coercive power. This is the contingency is forced. One person has more force than another. And that's the contingency of the relationship. It's contingency based on force. Now, this can go both ways, you see. And it can oscillate between these. There can be reward power maintaining the relationship from one pair of eyes, and then from the other person in the relationship, it could be coercive. I got a 13-year-old kid, and I say, because I'm New Age aware, you're going to go to Mary Beth Prevey and have a massage once a week. Or I'll kill you. Let's go. Okay? Now, what's that going to do to the relationship between you and the kid? Okay? It's based on coercive power. All right? Third one is identification power. Identification. This is a contingency on hero worship. Oh, I come to see you because you're so wonderful. You are just so wonderful. I have to come and see you every week. And then you say, God, isn't it nice being wonderful? You're maintaining the relationship because of reward power contingency. They're maintaining a relationship out of identification power contingency. The best thing you can do for the relationship is point that out to them. You're blowing smoke up my butt, and I'm getting off on it. That's sick.
It was my elbow and my
You know, that's a sick relationship, okay? We're going to stop it now. I guarantee you, you will have enough conversation to carry you for the next few months that will be therapeutic and interventive. If you stay in what's going on in the relationship, that's all you have to do is talk about it. Okay? Fourth one, legitimate. This is great for gurus and people who want to be adulated for how spiritual they are. This is contingent on accepting the moral authority that the other person presents. You come in and see me once a week because I have declared myself to be an enlightened being. And you buy into that. Okay? Or I channel a 4,000-year-old, whatever. You ever notice the people that are channeled are never like, I cleaned up the stables for the pharaoh. I was up to here in horse crap. They're always somebody else. What happened to those people? So it's contingent on accepting the moral authority. Priests, rabbis, people like that, okay? Those all fall into that category, and you can fall into that category. Especially when you start believing the things people tell you about yourself. As soon as they start telling you how wonderful you are, throw a big flag up. Especially when it starts to feel good. Because when your ego starts getting involved in this work, that's when all the goop and stuff that comes off of people stick to you, because it sticks to your ego. Your ego becomes like flypaper. And when the massage cooties start flying around the room, that's where they stick. They stick on the ego flypaper. So you start believing all the stuff about how wonderful you are that people tell you, and then you go home with all the cooties on it. Okay. The last one is expertise power. Expertise power. This is contingent on a person wanting the knowledge of another one. The contingent on knowledge that you have. And the way that you maintain that relationship for your own reward is you maintain the relationship by you don't give up all the knowledge. You don't give it all up. You keep people coming back for more. Okay? That's how you maintain the relationship. You're the expert. Now, out of those 5, initially, that's what's going to get people into your office. Not coercion. That's pretty far out. If you're a psychotherapist or something like that, that's more likely that will happen through legal means and so forth. You're on probation and now you have to go see Dr. Sinkule and she's going to shrink your head. That's, there's no therapy that's going to take place there because that's based on coercion. But the other 4 is what's going to bring people into your office. The interesting thing about all 5 of these is the zero-sum principle operates. Very interesting. I walk into your office, one of these is the contingency that's maintaining a relationship or starting a relationship or whatever. As soon as I enter into the relationship, if I've got 5 units of power, I give up at least 1 to you, and I never get it back. So if we both have, in the relationship, we both have 5 units of power, you end up with 6 and I end up with 4. Okay? There's always that exchange. It's like a mathematical exchange. In all of those. So what you have is you have a relationship that has as its conclusion freedom from. The only freedom is freedom from you, or freedom from that relationship. Okay? That's it, because I've lost. I walk in with a pie, you know, the old mathematical thing when you were a kid, they start you off, well, you have a pie, and you cut it in half, and go, you know. You take half my pie. That's part of it. Or it can go the other way around. If somebody comes in and pays you $50 and that's the only reason you put your hands on them, you're giving up some of your power. So there's this exchange. And those contingencies maintain the relationship. The zero-sum principle, that's what makes the exchange happen. And it's always a freedom from relationship. Freedom from. Now, you can oscillate through these too. There can be 2 of these going on at the same time. It can move from reward power to legitimate power, and it can be going on and on. The important thing is to be able to realize it, analyze it, and be honest with yourself. And then use that information in the relationship. When you start doing that, oh yeah, and the other thing about these is these all go along the horizontal axis of the 90 degree. Okay? It's all on the horizontal axis. Now think about it. As you're visualizing it as I'm talking, were you not visualizing it along a horizontal plane? Left to right? There is one other place, and guess where it is? It's the vertical axis. The interesting thing about this, and this should be the goal of all the relationships that you have with your clients, and I call that sharing power. The zero-sum principle doesn't operate. I come in with a pie and you have a pie. I leave with 2 and you have 2. It's like a breeder reactor. Instead of freedom from, it's freedom to. Both sides win. Nobody loses anything. This is the most effective place where any intervention can take place. Both sides win. Nobody loses. Zero-sum principle doesn't operate. Talking about the vertical axis. These are Western tradition. Sharing power is Eastern tradition. Time is involved in these 5 on the board. Time is involved. Linearity is involved. In sharing power, there isn't any time. If you're operating with your people in sharing power, the biggest problem you have is having a big enough clock in the room. Because time stops. And if you don't have the witness overseeing all this, then you miss it, you know, and you rub the person until 5 hours is up, and you have to send them home in a large hefty bag.
I never touched a person without that communication.
With the witness. Yeah, of
I
course.
mean, I have before even, as they're putting their feet on, I have a few, 15 seconds, just quiet, so we would make that connection.
That's become your ritual. It's become your ritual.
And then as I work, there's just this clarity that I think.
Do you understand what I'm talking about, this contingency of power? If you keep this in your mind all the time and analyze your relationships, you'll be surprised. And if you're honest with yourself, if you're real honest with yourself, it will accelerate your relationship with your clients so phenomenally fast you won't believe it. But you've got to be honest with yourself about what's going on. If you're laying a guru trip on people, and you're working on expertise power because you're getting off on it, you're setting up a situation where your reward that keeps the relationship together is getting them hooked on expertise power, and you want a turban on your head, you got a sick relationship going. You set up a sick situation, and the end result has to be bad.
I kind of got a question along that line. What do you do, or, you worry yourself about it or whatever, if, let's say, for instance, in sharing information, like you say that these things are going to be helpful in the massage, this really is a temporary kind of thing, since most of what I do is relaxation massage, or you have this area here that I really don't feel like I'm addressing as well as I'd like, I would suggest you go, this person that I know can, maybe do a better job for you, or it's nice to experiment with different kinds of body work. I enjoy that myself, and they choose not to do that. And sometimes it makes me feel anxious because, I don't feel like then that I am doing the most that I can for them, but they're not taking it.
The only reason that can be a problem is if in your honest analysis, you're upset and pissed off because they're not falling down and worshiping you as an expert. Then there's a problem. But if we're operating out of sharing power, and you're trying to give the best intervention you can, which may be referring and giving advice and so forth, but see, the thing is, nobody can tell. You're the only one that can tell with this. And be honest with yourself. Okay, you follow what I'm saying?
Right, well, that's what I'm saying, and what do you do it for yourself? Because I, feel like I have shared this. I don't have the expertise, is what I'm saying to them. Or,
Oh, but I want to come to you because you're so wonderful. Boy, drop that one like a hot potato. Disclaim it as soon as you hear it come out of their mouth. Somehow, you have to disclaim that. You can't let that stick to you. Oh gosh, you're so wonderful. The only thing you can do is use this. This is a dynamic system. If you use it to analyze your relationships, it will enhance. If you're honest with yourself, it will enhance everything that you're doing. It'll turn the volume up on the amplifier by about 5 notches.
Have you ever said to somebody, I really can't do any more, you need to go and see?
Sure, I say that all the time. Of course.
What if their level of satisfaction is different than your level of satisfaction? Can you still maintain a relationship? Maybe I want more for this person than what they want.
Why do you want more? Do you want more because they'll tell you you're great, or you want more because...
There's more wholeness for that person.
Okay, then, where does it fit on this? You have to answer that, Well, maybe you're coming from the sharing power, You get 1 pie on your power shelf, and then after they leave, you've got 2. And as they're walking into the car, you got to peek out the window and see if they got 2 also. If they're walking out with their hands in their pockets, something goofy happened. That you need to take a look at that has to do with personally you. And again, that's another lonely place. There's nobody that can give you the right advice on that. You're the one that has all the answers for that. This is another little dialogue that will throw out for you to toss around in your mind and drive you crazy. Get it easy.
So what you're saying is analyze which one of these 5 your relationship was.
Yeah, and realize that it's dynamic.
Get rid of it as soon as you can.
It'll continue. Yeah, your goal is to get to sharing power, where they leave with 2 and you got 2. Time stops. Okay, the zero-sum principle isn't operating. Both people win. That's the area that you want to play in.
So these
You don't want
areas
them to lose anything coming into you, and you don't want to lose anything either. So clean up the relationship. It's a real easy thing to do, but the hard part is being honest and analyzing it yourself.
So those are our failings, the weak ones.
They can be, yes. You betcha. Those are some of the chuck holes along the road, So when you fall in one of them, go, oh, there it is, you know. Then you can make adjustments to that. When you don't make adjustments, you don't beat yourself up because one of these is going on. You make the adjustment. That's what the system's about. It's dynamic. It's like an amoeba. It's always changing shape. Always. Okay. Well, we could stay here another week. We could get into ritual, and I've got some other things that we could do to analyze the effects of energy on each other and energies of your client. I'm feeling a need to give you some feedback on how you work around tables. So my thought is, and we can adjust this however you want, my thought is to take a half hour and work on each other, and work on your partner, and then we'll switch and do another half hour piece of work. And just do work, do massage, grease them up and do massage, and let's see how you move around the table. Ann will be videoing with this camera, Susan will be videoing with that camera. I'm going to do a little bit of work on Sam, so I want him for a while. I want Sam for just a few minutes, so we might have to hold off on one person starting for a few minutes. Now, if that doesn't sound right, we can wrap this up however you want.
Are you still going to touch on ritual?
I can, yeah. I can, yeah, sure I can. One of the neatest books that gives a concise thing on ritual. If you haven't seen the work of Antero Ali and Angel Tech, did you really? It's neat. Antero Ali's Angel Tech. A-L-L-I. Antero, A-N-T-E-R-O. Antero Ali, A-L-L-I. The book that I'm recommending is called Angel Tech.
Angel?
Angel Tech.
T-C.
Yeah, like Albion Tech University. Very concise, and he's cut through a lot of the mystic mumbo jumbo of the old ancient wisdom and so forth. And what I've done is I've taken some things that I can give to you that he says about ritual. That's where I got this stuff. Or if we don't get into that, I'll just leave this handout up here, and you can come up and copy it if you want. But it's all, I just took it straight out of Antero Ali stuff because it's so concise. The only thing I would say about ritual is you don't have to, it can be very, very simple. It can take just a few seconds. And it's whatever form whatever you want the form to mean. That's the only thing about it, I mean, you can get into, before somebody comes in, you can do a half hour of incensing and smudging, bowing to the east, and, put a chicken on your head. You can do all kinds of things, and you can wear all kinds of talisman. I mean, you can be loaded down with crystals and stuff hanging from your neck, and gold, and, then you get into gemstones, and you've got them everywhere, okay? They're only as effective as they are serving a purpose. And whatever story you make up about the talisman or the ritual, realize ritual, and Antero Ali points this out, it's so important, realize ritual isn't routine. Two different things. And, it doesn't take much. One ritual that I do that has been so important for me is if any of you have been worked on by me, you know immediately when the session is done, I'm out of the room. I'm done. I'm out of the room, and I go to the bathroom. And what I do is I take cold water and I bathe my arms from here down. Water is one of the best cleansing things you can possibly do. Try it after you do your half-hour massage. Go right in there and with cold water. That's it. And it has come to, over the years, over the 11 years that I've been Rolfing, it has come to mean so much. It's just like the concept of icons. Okay? You put up a Star of David, and it means an extraordinary. You could spend your whole life talking about what that means. And over time. So, that's basically the ritual. The other thing I want to say about ritual is, and I fell into the whole thing of, man, I mean, it got so that I was doing more junk when I first started. I was shaking more rattles and bones and everything, okay? And then I was reading this thing, and I can't even remember what was in a journal, and it was about this incredibly powerful healing system in one of the Philippine islands, okay? And these people were the shaman for this island, okay? And this gal that was so good, and she was going through her pre-work ritual, and she said this prayer, okay? And there was the words that I didn't understand, and then there was the translation. God, help me, let me help this guy. What else is there to say? So make your rituals very simple. Very, very simple. All right, let's do it. I'm going to leave this up.